Thank you again, Dr. Shigekawa. Our final clip is with Dr. Masako Kusayanagi Miura. Dr. Miura was born in 1914 and went to school in the Los Angeles area. She completed her pre-med and medical education at USC before the war. And like Dr. Shigekawa, she too was a resident at LA County General in 1941, only in dermatology. And she also was fired. She was one of only 5 physicians at Manzanar before moving to Topaz, where she continued to practice after she gave birth to her first daughter. After the war, Dr. Miura returned to LA to complete her residency and practiced in Little Tokyo before eventually relocating to the Monterey Bay area. The following clip is an interview with the Little Tokyo Historical Society in March last year. Dr. Miura talks about the relationship between the doctors and patients.
Do you think that healthcare was adequate in those days for Japanese that lived, or do you think that a lot of bad things happened as far
Well, you know, in those days, it isn't like here now, where you go through, you know, all these health services and all that.
Mm-hmm.
You know, you had direct contact with the doctors.
Yeah.
And you paid directly.
Yeah.
And you don't have to go through any third party or anything, so.
That was even in my lifetime, actually.
Yeah, it's actually better, I think.
Mm-hmm. Yeah,
because you know just exactly where you stand.
Mm-hmm. And I guess a lot of times when people couldn't afford to pay, then
they brought in things to, you know, to compensate for it.
Oh, like vegetables or
yeah. Because it's things that you need anyway.
Mm-hmm.
This was during the Depression?
Yeah, well, I mean, you know, some people couldn't pay, and if they brought in some things, you know, and some of the doctors looked it up. Because I remember going to some of the dermatologists, to some of these doctors that were well-known doctors, you know. They should charge, what, $5? And then $2 for a visit after that.
Mm-hmm.
And I looked at it, and they said, well, you can pay later on if you can't afford it now. You know, and go to the office, and they're very lenient with their patients, apparently.
Mm-hmm.
They're not like right now, you know, with the
billing system.
Yeah, the billing system. Oh, I mean, it's horrible.
Well, Dr. Miura was unable to join us today, but we send her our thanks. And this concludes the video presentation.